Part 2 is about understanding your wife's and other female family members' rights as patients. In the United States, all people have important rights as patients. Some of these rights are guaranteed by US laws. Here are a few rights that are important for your wife and other female family members to know. All patients have the right to be treated with dignity and respect. You should never be discriminated against for any reasons. This includes race, religion, sex, ethnicity, sexual orientation, country of origin, and more. If you feel that your wife has not been treated with dignity or respect, or has been discriminated against, you can make a complaint at the clinic or hospital, and it will be investigated. You and your wife cannot be retaliated against or receive less medical care because you made a complaint. All patients have the right to privacy and confidentiality. This means that your wife's health information will be kept securely and it will not be shared or released without your wife's permission. This means information will not be shared with anyone, including you as her husband or family member, unless she says it is okay. Medical providers take privacy so seriously that they will not leave detailed messages on your wife's phone without your wife's permission because someone else could overhear it. Your wife or other female family members may be asked to sign a form called Release of Information to show that they give permission for someone else to know about their health. In the Release of Information form, your wife can give permission to share certain information but deny permission for other information. For example, your wife can say it is okay for someone to know about a health appointment, but your wife does not want them to know the results of an exam or medical test. Your wife can cancel a signed release of information anytime and for any reason. Because all patients have the right to confidentiality, medical providers will want to meet with patients privately. This gives needed privacy for patients to talk about health concerns or issues they may be uncomfortable talking about in front of other people. This means you, as the husband, will normally be asked to wait in the lobby while your wife has a health visit. This also means that the parents of older girls or young women can often be asked to wait in the lobby. Patients have the right to receive health care that they understand. This means medical procedures must be explained to your wife before they happen, and your wife must give permission for them to happen. The only exception to this would be in a medical emergency where a patient cannot respond and the provider must act to save a life. Your wife's medical provider needs to understand your wife clearly to provide good care, and your wife needs to understand what they're telling her about her health. If your wife is concerned about not understanding the doctor, she has the right to ask for an interpreter. It is the interpreter's job to relay information correctly, and they are required to keep your wife's information confidential. Any medical professional, medical clinic, or hospital that gets money from the US federal government is required to provide free interpretation to people who need it. Your wife should always let a medical clinic know that she needs an interpreter when she makes an appointment so that they have time to arrange one. If your wife is seeking care without an appointment, like for an emergency concern, she is still entitled to an interpreter and should ask for one. Your wife can ask for an interpreter by saying, "No English, I speak Dari." Friends and family members, especially children under 18 years old, should not be asked to interpret for. In the United States, the law says no one can be turned away from medical care because they do not speak English. Your wife also has the right to ask for certain things so that the appointment is more comfortable for her. For example, she can ask that her exam be done by a female medical provider. If she wants a female medical provider for her appointment, ask for one at the time she is making an appointment. If for some reason a female medical provider is not available, the clinic may ask you if it is okay if your wife is seen by a male medical provider. Depending on the urgency of your wife's health concern, she may say that is okay or choose to reschedule for a time when a female medical provider is available. It is important to know that if your wife agrees to see a male medical provider, they will often have a woman with them in the room during sensitive parts of the medical exam, like a breast exam or pelvic exam. Patients can also request that a female staff member be present during these parts. All patients have the right to ask their medical provider questions. Your wife should bring up any concerns and questions she has during her appointment. If your wife's medical provider does not have enough time to answer, they may schedule your wife for another appointment. They may also order some tests or refer your wife to another doctor who specializes in her concern. Because this is an important time for your wife and your wife's medical provider to discuss her medical needs. If you have young children, try to arrange for someone to watch them while your wife is in her medical appointment at the hospital. It is common for many women to feel nervous about a women's wellness exam. Your wife should tell your medical provider how she feels so that the medical provider can work to make her feel more comfortable. In video 3, we will discuss what will happen during the women's wellness exam. Thank you for watching.